João, I would like to invite you to come up on the stage and tell us about yourself and your project in a TED Talk style. You've got...
Okay, so everybody's listening to me? Yeah, it seems at least that's the case. Let's get down to it then. So, I'm here to talk about the API project and of course one of the biggest use cases at the moment, which is the Gravitate Health project, okay? So, basically one of the core aspects of us in order to create this project was the case of Maria. As you can see her, she's, at least for us, very, very important and famous, which is basically taking into account that all these leaflets that come in the packagings, they are usually paper-based, static due to that, very difficult to read, not only due to font size, but also to the legal aspect of this document, which is sometimes complicated to understand. And so we come up with this idea that why not try to transform all of this into something that is more digital, more interpretable by machines that can automate a lot of different things in order to basically improve medication adherence, information, satisfaction, and in the end, the quality of life for Maria and basically all of us, okay? And we thought, well, let's then create this project, and of course, fire as one of the major key aspects of it. So, we'll try to transform all of these leaflets into fire artifacts. You'll see just in a moment how can we do that. And not only to help Maria, but we think that a lot of different stakeholders can actually also take part of it and enjoy the results of it, like pharma companies, health tech, regulators, developers, of course, but health information providers as a whole also should take notes. So if you are one of these, let's get down to it. So, of course, I need to approach the fire specification. As you can see, several fire resources are taken into account to build this project, and they are basically the results of the ongoing project. And the thing is, we're talking about some very complex definitions, and that's why we need at least 13 resources. You'll see just in a moment that you don't need to use all of them if you want to create fire APIs. There's some layers to it, but this could be the overall usage of them. And of course, they are connected with the concepts of the medication that we're trying to explain and the leaflet itself. More so, we can basically create this network of relationship between the artifacts. Don't worry, I know it's tricky to understand it at first glance, but we'll go step by step. And so, first step, we have leaflets. We have this human design narrative text that we want to convey into a digital format, but also we have product information that we want machines to be able to interpret it and read it and do, well, several things with it. We'll go there in a minute. So we have basically two things. One piece of text or pieces of text that are aimed for humans to read, at least in theory. Sometimes they get a little bit complicated. And on the other hand, we have product details like the GTIN, ingredients, clinical use definitions or indications, contraindications, warnings, side effects, so on and so on, that can be proposed in a structured format in order to satisfy this. And so we thought, well, this can be overwhelming. We're stating basically that you'll need at least one of 13 different fire resources in order to create a fire API. That's tricky to do it at first glance, especially for people that have no knowledge or prior knowledge of fire. So let's do it kind of in an increasingly complex but also more useful way. And that's why we came up with the types, which are from 1 to 3, even though there's a fourth one that I'll get in a minute. So the first one, it's the easiest one, but arguably the less interesting in terms of usage, which is basically take the text, we put it in the fire resource with some HTML tags, and that's it. So composition and narrative text. That's it. Basically just taking one, transforming into the other, and we're done. But then, well, since the moment that we have this type 1, let's do a little bit more and try to add these more definitions, this terminology part of the medication, creating the definitions of said medication, and put it on top of what we already have. And here we can have these structured product details, the packaging details, medicinal product details, manufactured, admissible product, so on, so on, so on. And then the last part, I mean, since we already basically covered what is in the current leaflet, why not do a little bit more? And so we're starting introducing the parts of the clinical part of it, you know? Let's do indications, contraindications that are often there, but by any means in a structured and terminology-binded way. And during one of the last Connectathons, we thought about, well, since we have almost everything, why not do the other way around? Let's have, instead of getting narrative text that we want to transform in structured texts, why not having structured just from day 1 or day 0, right? And so, well, if we come up with this type 4, which is a fully structured API that can be done from day 0, even before the medication is on the market, and with that, we can apply a template and create the full narrative text from structured information. So all of this can be done with FHIR resources, of course, on top of a skeleton that can create sections and subsections and so on. And in the end, we would have a copy of the current leaflet, but with all of this knowledge behind it that we can use. And so, what we think about this? First, submission process can be accelerated, as well, of course, the approval and authorization process, and also the usage. So we can do kind of full loop here from day 0 until the end of life of the medication using structured information. So we aim to have first a submission process and validation of the better quality assurance and control during this process and even afterwards. Even for updates and variations, this back and forth between regulators and the ones that are making the submission make it more streamlined and easier to manage. And of course, since all of this is structured, we can have analytics and automatic evaluations of this process as well. And we have done some steps in this direction to create this type 4. We basically started with a European SMPC, and of course the patient information leaflet. We already mapped it to the corresponding FHIR resource or resources, even elements at some point. And it is a fairly straightforward process, even though sometimes there can be some doubts about it, but we are doing the process. And in the end, you would argue, well, you probably got with way over the 13 resources that you stated before, and that's actually not the case. We just found that we needed just one more. So basically, all of the information was already there. Probably need some elements that need to be tweaked or added, but most of them already contain the information that we required and was already stated and the API. So that's wonderful news from what I know. Just to finalize, we can handle variations with this as well. And I think one of the use cases that I can show you is how we in Gravitate Health use the API with the FHIR API. That we can create lenses and use the International Patient Summary in order to create personalized APIs. We also trying to leverage AI, since we already have all of this information in a structured manner, chatbox, retrieval augmented generation, anything in between can be done in a more streamlined manner since the contents are already in a LLM readiness state. Just some screenshots of what we've been doing. One of the topics that we are now discussing is how to present this to the users, because we can have the content, but then how to present it in a digital format depending on iPads or tablets or phones or browsers needs to be tweaked, and even more when it's in a personalized manner. And of course, our chatbot and AI summaries that are interesting to explore as well. To finish, regarding the API project, we are actually focusing now on style sheets, how to separate content from the format, and how to convey that in a seamless manner. On top of it, user interfaces, further focus on the type 4 and how can we improve submission and variation handling, and of course, trying to help implementers with transformation from PDF to FHIR, visualization, and of course, improving the implementation guide. Thank you.
I think we've got time for one question, if there's any questions in the audience. I'm glad you came. Thank you.
Oh, wow, very interesting. In the Netherlands, we host in our institute the Pharmaceutical Compass, which was built on a 40 years ago, where we put all the medication, and they're probably on old XML structure with editors. So I think that's very interesting to connect, and also to learn from you how to implement. So is the open source? Can it be reused? Is the community? How do you?
It's my pleasure to send it away.
Okay. Yeah. Thank you.